Hi, I'm Dr. Jim Lynch. I'm going to take a few minutes to go through the risks of the stellate ganglion block procedure, or SGB. The risks include pain, bleeding, allergic reaction, damage to surrounding structures, seizure, and then the risk of making your symptoms worse. I've been doing this procedure for about 15 years on thousands of patients, so I have refined my technique over the years to really minimize risk, minimize discomfort, maximize effectiveness and safety. So what I'm going to describe here is how I minimize those risks in my technique. The risk of pain we can mitigate greatly by using a very, very small needle. And under ultrasound guidance, you can see the needle clearly, and it involves just a little sensation of a prick, like a pinprick, or almost like an immunization without the burning part. That little prick was followed by the sensation of pressure as I inject slowly, but it's really a minimal amount of pain. The discomfort that you may feel afterwards is kind of like you may get a little muscle soreness after a flu shot. That kind of sensation that may last for a day or two is possible. The risk of bleeding is really low. I have used a Band-Aid maybe a couple of times this year. The risk is that low. Most people don't bleed at all with the size needle I use. It's also very rare then to have any bruising or have a hematoma, which is bleeding beneath the skin, using such a small needle. So those risks, while they sound scary, are very, very low with the technique that I perform. The risk of allergic reaction exists with anything, any medication that you use, but we use ropivacaine, which is a long-acting anesthetic that's been safely used in a number of settings. Most importantly, we use it in pregnant women, which is a good indicator of the safety of the medicine if it's good to use in pregnant women, and we use it for an epidural and other things like that. The risk of damage to structures is the one that I take very seriously, and it's the reason why I use ultrasound to perform this procedure. You can see the structures under the skin beautifully with ultrasound, and what we're primarily trying to do is steer the needle safely to the cervical sympathetic chain or cervical sympathetic trunk without touching any other important structures. And there's a lot of structures that live right here in this area of your neck. What ultrasound allows us to do is to guide the needle away from things like your blood vessels. So while one of the risks described of this procedure is puncturing a blood vessel, it would be really hard for me to do that when I'm looking at your blood vessels under ultrasound. And to give you an idea, they light up in color. So we use Doppler imaging to scan your neck under ultrasound, and then we can see your carotid artery and your jugular vein and steer clearly away from them. So this is something that allows ultrasound to really buy that risk down to virtually zero. The risk is not zero, but again, it's very low when performed by somebody who's very experienced using an ultrasound machine. The risk of seizure is an interesting one in that for a seizure to occur, I would have to puncture a blood vessel and then inject the medicine into it. I've already said that I do avoid blood vessels, and I try not to get anywhere near them. And under ultrasound, I can see that very clearly. So the chance of me puncturing a blood vessel and then injecting the ropivacaine into it is very, very low. Again, those are scary sounding risks, and these are the things that I do to mitigate those risks. The risk of pain, that some people sound like it would be a painful thing. Some people sedate their patients for this procedure. That actually incurs additional risk, because sedation is a risky thing. And because the pain feels slightly like a flu shot, it just doesn't make sense to me to sedate someone or increase the risk of the procedure for something that feels as mild as a flu shot. And most people after the procedure say something like, "That's it," and they're kind of surprised at how little discomfort there is. Aside from those risks, there are some side effects that are temporary, that may last 2 or 3 hours afterwards that are important to know. One is your balance will be off and you'll feel a little wobbly on your feet, which is why we recommend not driving for 6 hours. So if you come for the procedure, we want you to bring someone to drive you or use a rideshare service or something. But you will feel a little wobbly, and that's normal. The other thing is it will feel strange when you swallow and maybe give you a weird sensation in this area. Occasionally there can be a little numb spot on the skin, that's possible. And then commonly people feel a strange swallowing sensation that can be bothersome or kind of a nuisance for 2 to 3 hours. It's not dangerous or harmful, it's more just feels weird. And what it is a phantom sensation that there's something here in the side of your throat that feels funny when you swallow. So you ought to know that ahead of time and know that that's a common occurrence. and it usually goes away in 2 to 3 hours. Occasionally, people with that get a raspy voice, or they actually lose their voice and have to whisper or talk like this for a few hours. That's kind of annoying as well. Again, not harmful or dangerous, but if you don't know it could occur or don't know it's normal, that might concern you. Sometimes people get a little tickle cough with it that's like a sound, or the sensation that when you go to take a deep breath, it makes you cough a little bit. These things, again, are the kind of thing you get used to in a couple of minutes and they go away in a couple hours. So they're really not that concerning to most people. One of the other things that's temporary after this procedure is what's called Horner syndrome. Horner syndrome is not a side effect or a risk. It's actually what we want you to have. Horner syndrome describes some changes we see on your face that actually show that the procedure is performed correctly. And what that looks like is a droopy eye that's bloodshot with a small pupil on the side the procedure is performed on. Horner syndrome is the sign that the sympathetic nervous system has gone to sleep. And when that happens after this procedure, the normal response is for the eye to get bloodshot and droopy, and also for you to have a sensation, almost like a head cold, as the sinuses and your nose lining become somewhat congested. That's normal as well. And some people get a little rosy cheek or some warmth on the side of the face. All of these are the normal response to a stellate ganglion block, which doing what it's supposed to do, which is turn off the fight-or-flight system and the blood vessels dilate on the side of the face. This lasts about 6 or 8 hours, but by 8 hours, it's gone. Your eye goes back to normal, and you go right back to what your face looked like prior. These are the risks and side effects that I see with the stellate ganglion block. Again, when performed under ultrasound guidance, without the use of sedation, it's an extremely safe procedure. It's been performed for 100 years, and in the hands of someone who's an expert, it's the kind of thing that's a very safe, very straightforward procedure. I hope this helps.